My name is Taonga Chiralika, and I am the project coordinator for the Data Use Acceleration and Learning Project. I am based in Johannesburg, South Africa, and I'm very pleased to be joining all of you today. I will be taking us through a brief presentation to talk through the Data Use Acceleration and Learning Project, and I will also be joined after the presentation by my colleague, Dr. Puta, for any conversation or questions regarding the presentation. We can see the potential for digital and data use all around us, and it's becoming even more relevant as the world grapples with the global pandemic. The use of routine health system data can help to understand and curb the devastating impact that we're currently witnessing with COVID-19. At the same time, healthcare practitioners and ministries of health have learned many important lessons about what makes the development and introduction of digital health solutions and data use practices likely to succeed. So the challenge arises that as countries are increasingly using digital tools and instilling a culture of data use to achieve better health for their citizens, there's often a gap between the people designing these digital systems, the local stakeholders that are implementing them, and the funders and policymakers that are defining digital health standards and guidelines, resulting in sometimes a missed opportunity for impact. The Data Use Acceleration and Learning Project is a partnership between Parth and Cooper Smith, and it aims to accelerate the scale and impact of digital health solutions by collecting, synthesizing, and sharing learnings from 5 countries that are systematically transforming their health systems through the better use of data. The diagram here shows that the project was launched in September last year, and from the beginning of 2021 until now and going all the way up until August, we are gathering evidence, and we're gathering evidence as well as prioritizing our findings. From about August until February next year, we'll be developing digital transformation models, and from February next year, we'll be in a position to disseminate and share some of these findings. The 5 countries that we will be looking at include Burkina Faso, Ethiopia, Malawi, South Africa, and Tanzania that received funding from the Bill and Melinda Gates Foundation and support from implementing partners to digitalize healthcare and strengthen the use of health data to achieve better health outcomes. Based on the findings from these 5 countries, we are working to develop a model for digital transformation for data use that will enable other countries to replicate these countries' successes and best practices. So the model will be shared with governments, implementers, policymakers, and funders to better align financing, normative guidance, and pragmatic approaches for digital health. So Dual's model is being developed using a process that invites a wide range of stakeholders to contribute their learnings, whether they are investors funding digital health programming or implementers designing more impactful software platforms. It includes a wide range of stakeholder consultations. So key to this process has been the development of an implementation framework, which will inform the evidence gathering process and define the core components of a model for digital health transformation for data use. One of the main reasons that we are here today is to share a little bit more about this implementation framework with you all today. The current graphic gives an indication or a snapshot of what this implementation framework looks like. And our implementation framework builds upon existing global and normative guidance, such as the WHO, ITU, eHealth strategy building blocks. So whereas current frameworks and models are often high level and do not account for country experiences and lessons, Dual's implementation framework focuses on all the components required to digitalize a health system, from the health workforce to financing to change management approaches, so that countries can adapt and apply lessons to their unique landscape. This current view of this implementation framework, or the summary that you're looking at now, was developed by reviewing common themes across 36 existing models, frameworks, and guidance documents related to data use, digital health, and health information systems to determine where there were commonalities and where there were gaps. So Dual, as a part of this project, will then apply this implementation framework to guide a process that aims to center the experiences of countries implementing digital health solutions in two key research phases. So the current slide looks at the process that we are following in the development of this digital health model, as well as the process that we are looking at as part of the stakeholder engagement process. So to begin with, looking at February to August 2021, which is the evidence gathering process, a comprehensive document review helped to determine key themes within the current evidence base from the 5 countries. Following this, Dual has started or will embark on the second phase of data collection, which will use primary data collection processes to invite country leaders, digital health experts such as yourselves, to contribute to a model for digital transformation. Using key informant interviews and country discussions, we will collect and synthesize country learnings to determine the critical factors for digital transformation. Throughout our process, we will engage key stakeholder groups representing country governments, policymakers, funders, implementers, and partners to validate findings and make sure they resonate with the many different players involved in digital programming. An initial group of technical experts will be consulted early on to help define lessons, best practices, and the critical factors to achieving digital transformation within country health systems. A second advisory group composed of senior leaders from country governments, technical partners, and digital and data champions will also play an important strategic role towards validating and socializing these country learnings. Once this process of evidence gathering is complete, Dual will share critical success factors, tools, and approaches from these countries, focusing on the components that lead to sustainable, country-driven digital health programming and data use practices. And by documenting, sharing, and reflecting country learnings, we will then be in a position to advocate for changes to digital health financing, policy implementation to better align with Dual's model. So across these 10 slides that I have presented today, I have given a brief indication of what the Data Use Acceleration and Learning Project is all about, as well as touched on the implementation framework that we will be sharing in more detail with the colleagues in this conversation, and really trying to determine what is the demand for this sort of learning and information. So with that being said, I'd like to pause here and invite my colleague, Dr. Puta, and others to contribute and ask questions if possible, if there are any. Thank you very much.
Yeah, thank you, Tonga. I think you've covered it well, but I'd just like to emphasize that really the reason for us presenting this or giving this overview of the Data Use Acceleration and Learning Project is really to lay a basis or foundation for a follow-up discussion with those members from AeHIN who would be interested to contribute to the thought process of the framework and to highlight what kind of issues are really important for your region. We've had similar discussions with Rakainsa. So what we're really doing is looking at different regions like Latin America, Africa, Asia, and so on, where we have those connections to get feedback, whether this is really something that would be useful for them, that would be demanded in their region, and of the frameworks of the elements so in the framework, which are particularly important to which region. And this cross examination of needs across different regions is important for the dual group, because they just want to have a sense of what is important where. And when we synthesize that, that would determine the next steps, what follows this dual use and acceleration learning process. Where will the investment be? Where will the funders be willing to invest more money, so that this actually translates into something that is applied in a practical way.
Thank you, Dr. Chilunga and Mr. Wonga. I think Dr. Bonchaya has something to say.
Hi, thank you, Tonga and Dr. Puta. I think it's very interesting. I have questions about you lay out the kind of the timeline on forming the framework, and then gathering, and then form the model, and then socialize and would like to implement to another country. But what role of those 4 countries in Africa will involve in this plan? You're talking about the Burkina Faso, South Africa, Tanzania, or something like that. Who will you working with, and what kind of how would you integration of that knowledge from 4 countries to form the digital transformation model, and who will be the lead on knowledge gathering, something like that? Over.
Thank you. Tonga, can you check that?
Thank you for that question. So yes, you have correctly highlighted, we have the 5 countries, Tanzania, South Africa, Malawi, Ethiopia, and Burkina Faso. Across the 5 countries, we'll start with Ethiopia. The Data Use Partnerships project was implemented across these 5 countries in the period of approximately between 2017 and 2020. In South Africa, the project was implemented in partnership with the University of Cape Town. So as an example, when we are reaching out to South Africa, we are working directly with the University of Cape Town. In Ethiopia, we are in partnership with JSI, who also had a critical role to play in the implementation of the initial project. In Tanzania, we're working closely with our country office in Perth, as well as in Malawi with our partner organization at Cooper Smith. I'm not sure if I've left out one country. So we are working very closely with the implementing partners across the 5 African countries, as well as reaching out to the different stakeholders from those 5 countries in the ministries of health and other implementing partners that were key to the success of the 5 different projects. So in terms of who we are working with in those 5 countries, it's a range of implementing partners, academic institutions, ministries of health, and other advisory and expert groups that we have reached out to be able to not only request for documents for us to participate in a document review process, but also to be able to speak to them further in an interview process as we collect primary data. I hope that answers the question. Dr. Chilunga, is there anything that I might have missed?
No, I think that's it. But I think the important thing to recognize about the DUP project is that it was actually government-led. The others were like partners, technical partners on the ground, helping the government to implement the data use partnership. That's why it was called a partnership, because it was across many partners. And yeah, this was quite a huge investment on the part of I think mainly the Bill and Melinda Gates Foundation, and yes, they've done some good work, some tangible results, and so as Taonga says, we felt, and the funding agencies felt that we cannot lose those lessons, and let's document them in a systematic manner. So we started with a document review, a comprehensive document review. There are people, different groups at global level and regional level and country level who are working on this project. And we finished, as Taonga said, we finished the review. Now we are filling in the gaps in knowledge. Oh, sorry, Dr. Alvin, that you can't hear. And now we're filling in the gaps of knowledge with actually collecting the primary data. And the primary data collection is not limited to those people who participated in the DUP, the original project. By the way, these projects are still ongoing, but it also includes those who were impacted by the program, as well as those who have interest or can be termed stakeholders in what is going on. So that is basically what I just wanted to add on a little bit. But what we are hoping is that we'll have cross-country discussions afterwards, and that definitely we want the engagement of those that did not participate, so that they can look at what has been found, add their own thinking to it, and then hopefully that information will lead us to a reasonable model that can say, well, maybe, this is like this and this is like that. Yeah. It's possible that the dual program, depending on the interest of expressed through this fact-finding mission, and depending on the interest of the funding agencies, yes. My view is that yes, that's the whole point. That you also find out what is missing in Asia or what is of interest to Asia, and then convince the funding agencies that it's worth investing in Asia as well, because they've identified these specific priorities.
So to me, it's kind of this project is kind of the implementation research projects, and you said there is kind of the core group, which is maybe academe, maybe the developing partner like PASS or the Cooper Smith, but you said this is the country rate, and how would these all the developing partner approach the Ministry of Health and do that project, and what are you going to measure the success of transformation to become to form the digital health transformation model? What I mean, I think it as the research question. So you gathering primarily, interview, working, literature review, but you said it implementing. What it mean by implementing? You are going to implementing some projects that show the transformation from the from one person a way of doing to another way of doing,
Yes,
and
yes, yes,
what
yes.
is the deliverable?
I get what you're saying, Bunchai. I think we haven't clarified one thing. We're talking about two different projects actually. There was an initial project, a first project which started in 2017, which was the Data Use Partnership Project. That was the first project. They have, some of the countries are very advanced and they're finished, others are continuing. Okay, so they were looking specifically at how can they improve data use, whether with digital solutions or without digital solutions. How can they get health workers to actually use data in their programs to make a transformation? Now, when they started this DUP, some places didn't even have policies in place. So you find that they've helped a lot to develop policies. They've contributed to architecture, like in Tanzania. They've developed standards with countries for digital health, which were not there. They've developed indicators for success for their ministries. This is what the DUP partnership project was doing. Now that some of them are finished, and even those who are not finished, they have some results. And it's showing quite a lot of impact in terms of policy alignment, financing, what you call it, the architecture, the word has gone, architecture, and so on. They've shown that they've actually contributed to influencing the government in saying this is going to be our policy for this is going to be our budget for this is going to be what we are going to adopt, these are going to be our standards. You know what I mean? So different countries of those five, they've impacted in one way or another. Some of them may be at policy level, some of them may be at architecture level, some of them with the standards, or even just improving the standards or clarifying some of them even at strategy level. Some of them had documents and they didn't know how to operationalize the strategy. So they've seen that success now. So now because of that, the funding agency said, well, this is good work, so let's document it. Let's see who is interested outside of these 5 countries, who else is interested in such work, so that when we plan for the next, then they just don't plan for the 5 countries, but they actually identify, for example, for argument's sake, you could say, well, this is a priority in Asia, and it seems to be an important priority. Maybe let's invest in that. Or this is a priority in Latin America, and it seems to be an important priority. Let's invest in that. This is the priority in Africa, and you know what I mean? So they'll use these results to determine what happens next, where the next set of investments go. I don't know if it's clearer. So the dual is just, it's like the documentation after the dupe, which was the data use partnership. Now the dual is to facilitate documentation and to garner and to get a feel of what the interest is from countries across different regions in this kind of thing. Is it a useful thing? Do the countries feel it's a useful thing? And that's why we're engaging people like AeHIN and Derkansa who deal with countries, so that we can use them, to get this feedback. Is it really a worthwhile exercise? Is it worth a further investment? Do the countries even have interest in this kind of thing? I don't know if that's clearer.
Thank you, Charunka. It's very clear. So I just saw this dual AeHIN research project, but it seems like all the 5 countries has some success and some lesson learned. So this is the documentation and try to formalize, structuralize the methodology that can be informed as a country. That I think this is very good. This is very good. I think AeHIN can be in Asia can be kind of the look at that frameworks and also share our learnings with this kind of the experience or I mean lesson learned from Africa, the verified success of that 5 countries. I think this is a good. Thank you.
In fact, what we're hoping is that there will be a cross-fertilization of ideas, you know, a cross-fertilization of ideas so that, yes, in as much as you can learn from these 5 countries, but you can also say, for example, yeah, I mean, that works, but maybe in Asia we've done this, which even works better than that. I mean, that would be fantastic because then it's, you know, it's an enrichment that you actually get the learnings from the other regions as well.
Hi, Dr. Puta. Fazila here. Can you hear me?
Zila, how are you?
I'm doing good. Just like to comment on that framework. Can you go one slide before?
Okay.
No, the one that had the WHO 7 elements. Yeah. So this dual implementation framework. So you have added data use ecosystem and change management. Am I right? The rest are all the WHO ones.
Yes, exactly. Yeah.
That's right.
Yeah. Okay. All right. Great. Just wanted to know that.
Yeah. Yeah, because the data use ecosystem and change management, this is what came out of this current experience. Yeah, that yes, it's good to have all these things, but we need an ecosystem and we need change management because some people just don't change.
Chilunga.
Alvin?
Hi, Chilunga. Sorry, there's a storm right now in Manila and the rest of the Philippines, so my connection is not so good.
Sorry.
I think the other Filipinos are also suffering through the connection. I wanted to ask, what are the plans after the 5 first countries in Africa? And because Chilunga, you're a member of the network of networks, so I think there's an opportunity for Dual to also influence the other regions. So are there any plans? When do you think you will be ready to share lessons learned and best practice from the first 5 countries? Over.
I think it's around, is it August? Taonga, she's shared the timeline.
Yes.
Because
Yes,
we want to share it quite very broadly as well. Maybe you can share the timeline, Taonga. I thought it was August.
Please,
around then.
it's the slide straight after this one. Yes, this is the brief timeline or the proposed timeline. Timelines can, of course, shift every now and then based on the project implementation or project progress, I should say. But we are looking at really finalizing the development of the digital transformation model between August and February, and then we'll be getting into the dissemination process and the advocacy process from early 2022. And that's when we would have completed the development of the model, packaged it in a way that allows us to be able to share widely with the different stakeholders. So this is a basic indication of that timeline.
Thank you, Taonga. Thank you. So based on this, it's really just 5 countries for now until we reach July 2022. So that's good.
Yes. Because the 5 countries we're just picking up the lessons they've learned. You know, and of course they've had challenges which will have to be addressed as well. And so we are learning from those 5. But the idea is to use this data that we collect to inform further investment. And as you say, you can utilize the network of networks, definitely.
True. Thank you. Can you go back to the same slide that Dr. Fazil asked for? And I think the additional component, as you mentioned, is the data management. Sorry, the change management, right?
Change management and the data use ecosystem.
Yeah, and the data use ecosystem, yeah.
What
But,
what what made you add? Yeah, what made you add these two elements over the WHO ITU framework? Over.
Thank you, Dr. Alvin. So in developing this framework, yes, we use the WHO ITU health strategy building blocks, but we also reviewed a different range of documents, 36 in total. And once we had sort of looked at those various documents, we also had a list of experts that we consulted. We shared our initial draft of the implementation framework with them. They came back to us, and between that extensive document review and consulting with some of the other experts in the field of digital health, we realized that change management and the data use ecosystem were quite important elements to add. And especially from my perspective with change management, sometimes it's the case that you can come up with wonderful concepts and applications and tools, but if those aren't properly implemented, the uptake will not be as successful because we have not planned for change. So really being able to manage that process of introducing new concepts to various cadres in the workforce is quite an important determining factor for success as well. So that's the process that we followed towards adding these two elements of change management and the data use ecosystem.
That's a wonderful addition. Actually, change management is really very difficult, and it has to happen at several levels of the architecture.
Yes.
That's good.
Can
Yeah.
I make a comment, Alvin?
Go ahead,
Uh,
Professor John. Go ahead.
yeah, it's a great presentation, and I would like to latch onto the change management. It really, really is important, and I feel like one of the things that we need to do is also, to assess the awareness and readiness of our of the users, the people that need to do the transformation. So, where are they now? Where do we want to bring them? And that's part of the change management, and how much they can expect from our efforts, so that we do not overpromise or underpromise, but just manage their expectations. So I think it's part of change management.
Thank you, Professor Jong. I think the challenge that we're all facing right now is the the whole landscape is so complex. On one end, you have basic infrastructure gaps in the remote and underserved areas. And on the other spectrum, you have people developing very complex algorithms with big data, machine learning, and artificial intelligence. I think the, the challenge and maybe the opportunity as well for the ministries of health is to create that conducive environment where where any stakeholder, wherever they are at, would have the ability to change. And it would be clear to them towards what direction that change will be. Whether you're in a remote island with very minimal infrastructure and you only have instant messaging or SMS, or whether you are a scientist with a lot of resources and now looking for a way to address the needs of those that are not easily served by technology. So we're looking forward to this change management lessons that you will have, Teonga and Chilunga. I was wondering, are you going to be using a particular framework, or when you get to that part of change management, like Kotter, or are you creating something new, or just open up a question about change in the FGDs or using your research methodology? It would be interesting how you plan to fill in that part. Over.
Yeah, I wouldn't be able to say exactly what will happen, but my view is that this is very open. Yes, we can use the current frameworks for change management, but we all know that when you are implementing them, there are some limitations that come out of those. So my suspicion is that it will be an open discussion with reference maybe to current change management frameworks. I don't know, Taonga, if you've got some more inside information which I don't have.
Thanks, Dr. Puta. Not necessarily some more information, but just a point that as we embark on the primary data collection and interview key informants, part of our key informant guide or questionnaire has a range of questions that are specific to change management, and we are going through a process where we can be able to map some of our Ministry of Health officials or other partner officials to be able to most appropriately respond to those change management questions that we have developed so far. So we have a set of questions that are specific to change management, and we'll be posing those to some of our key informants.
A follow-up question. Are you able now, do you have visibility now on the dynamic digital maturity model that's coming out soon? And if so, how would you map this against that upcoming digital maturity assessment? Or maybe Dr. Bunchay? Either Chilunga, Teonga, or Dr. Bunchay?
Sorry, I'm not sure, Alvin, how that will be mapped in. But my take on this is that when you come to do the model, I think there will be that comprehensive look at what is prevailing and what can speak to that model, because definitely in that assessment is important if you're going to say you're going to produce a model, because you need a way to assess where the country is. So my own take is that it will probably have a role, but exactly how it will be used, I think, would depend on the committee that will be actually doing the modeling.
Mm-hmm. So would you say, Chilunga, that we will meet again after 1 year?
Yes.
Or will there be an opportunity to do some in the middle updates with each other between the regions? Over.
Yes, as soon as we have something to report, and if there's interest, definitely we can feedback. And particularly if there's interest in inputting into the model, I think that one we can harness that feedback. But we are going to have, I'm hoping we're going to have another meeting with AeHIN sooner than later to discuss this implementation framework in detail,
Yes.
so that we can even look at what are the priorities for your region, what you think about various things, what is the level of interest. And as we were advised by the AeHIN Secretariat, we needed to give this preliminary presentation, and then we'll go into that one, which goes into in-depth, where we have small groups and really brainstorm these things and think through these things and give our input.
Thank you. Are there any other questions from the audience?
I think there is one question from Teputon. What are the role of the digital health ambassador? I think Dr. Teputon from Laos put this question in the chat.
I'm not sure what you mean by digital ambassadors. Maybe that's something unique to.
I think it in the slide. I think there is one point in the slide.
Oh, okay. Which slide was it? Can you? I think it's more for advocacy, isn't it? Can you find where you talked about digital ambassadors?
Where was that? I'm not sure where in the slides included the role of digital health ambassadors, but maybe what I can say is that in our dual implementation framework, especially under the thematic area of leadership and governance, you find that sometimes you do have maybe not necessarily ambassadors, maybe I can use the term champions. So within the leadership and governance structures of whether it's the ministries of health official officers or other collaborating ministries, there are champions that advocate within the ministries for the digital transformation and for data use. So I would answer this question to say that the role of digital health ambassadors is really to advocate for digital, for data use, for digital transformation, and for change management as well. Though I'm not certain where in the presentation I spoke about digital health ambassadors, that will be my brief response to that question.
Sorry, if I missed that part because my audio was down. Was there a criteria for the selection of the first 5 countries?
There was when the Duke partnership started when they were planning in 2016. But Alvin, I'd be lying if I said I can remember what the criteria was. But they did do some assessment. They did have
Yes.
some kind of assessment tool, which related to the data use and also to the stage where they were at in terms of digital solutions.
Yes.
I can remember very clearly for Tanzania because that was close to heart. They went really to town looking at what was in place, what were the policies like, was it even possible to do this data use partnership and have some results. There was definitely an assessment tool that they used to assess the countries. Things like was the atmosphere conducive? Was the first and foremost actually was the government agreeable? That was the most important criteria. Was the government agreeable? Was it willing to carry this through and even willing to release its staff to work on this project? So that was one of the most important things, was the government's willingness to provide leadership and to provide direction to the program. So, for example, even when they changed policies, it was not that the partner went in and said, let's change a policy. It was more like they are working with government, and then the government decides, oh, we want to do this. And then you go alongside them and say, oh, maybe we can do this, maybe we can do that. And actually, where we found delays in implementing of the project, it was because it was government leadership, and you can't push them. Once they do it in February, it's February, even if you think it can be done in January, but you can't push them. They won't take that pushing. So you found that in some cases, even that collaboration with that allowing government to lead, which was one of the most important criteria, that actually slowed down progress in some of the countries, because they had to go at the government's pace, whether they liked it or not. And the other things, of course, related to what could be done. Some countries have a little bit more advanced infrastructure, others don't. And then others, could you do just data use using non-digital? I mean, our countries can be so heterogeneous. You can come to Lusaka, you can do almost anything. You go to Mbala, you can't do anything. so when you're thinking in terms of Ministry of Health for a nation, there has to be that agility and flexibility. So those things were taken into account. What can be done where and what cannot be done where. So a kind of maturity. No, I wouldn't call it maturity as you guys are doing it intelligently. You know what I mean? But I mean, there was a kind of assessment to see where the country was at and whether it was really ready to do a project like the data use partnership.
Yes.
Yeah, I mean, that's one reason why Zambia didn't qualify.
Okay.
We didn't qualify. Yeah, but yeah.
Dr. Bunchai shared a link. It's a link to your theory of change. What's DUP? Dual project?
Data
Path
use
DUP?
partnerships.
Data use.
Partnership. That's the data is
Okay.
partnership.
Data use
That's
partnership,
the
right?
original. That's the
Yes, yes.
original project.
And that DUP theory of change also informed the development of this implementation framework.
As a matter of fact, if I may share my thoughts about data, there's actually a lot of data right now, but it seems like they're not really being used. And so I think that's why you're calling it the data use partnership, because
Yes,
it's not
yes.
really, I mean, there might be some areas where there are no data, and that's a fact. But even in areas where there's a lot of data, there's not a lot of agreed ways of how to process that. And even if some people actually do process it, when they start presenting it to the people who make decisions, they don't have, they don't get, they don't
It means
believe
nothing.
immediately.
Yeah,
Yeah, I think that's really a phenomenon that we need to understand. So looking forward to the results of your program. Maybe 1 year later would be too late. Let's have something in the middle, Chilunga, around November or December.
no problem. We can do that. Yeah, we
Good,
just have
good.
to process.
Chilunga, Tayonga, how will this relate now to the Health Data Collaborative? Will there be some synergies, or it's completely within the Health Data Collaborative, or completely separate from the HDC?
Currently there isn't really much um,
Connections.
deliberate connection. But the
Yes.
fact that the HDC is trying to work with DHIN working group, which is also trying to work with our Center for Digital Excellence, under which this falls. Inevitably, there will have to be that connection eventually, which says, well, this is what we found. How does it relate to this, or how can we synergize with the HDC or whatever? So I think those, because all these people, Sky and them are all they know about this, and our co-chairs for DHNI know about this. The Garretts and them, I mean, they know about this. So it's a question of bringing them together and saying, oh, this is what we found, and that will be part of the dissemination process. When we are disseminating, those are some of the groups that will get what has the outcomes of these things, because they are influencing global level policy, and we would be interested in what they think over our findings and how this could inform something that might work, at least even if it's by region, but might work to help the countries to move along.
Thank you, Chilunga. We're near the top of the hour. Maybe just very quickly, while the AeHIN audience are also in the call. Over here at Asia, what's turning out is AeHIN has started to support the formal multilateral organizations like the ASEAN. The Association of Southeast Asian Nations recently formed an e-healthcare technical working group. It's like the working council inside the ASEAN for digital health, and Dr. Fazila is one of the members there. So it's like emerging that we could provide support as an informal network to that formal organization. And I think we will soon have a speaker from WHO on the dynamic digital maturity. I don't know yet when that will be, but ASEAN is actually looking at that framework. So when we get that program, we'll invite you, Chilunga and Teonga. Maybe that's the time where we will hear more about the dynamic digital maturity model straight from the horse's mouth, because I don't know anything about it right now.
Yeah. No, that would be great, actually. That would be very
Yes.
useful.
Yes, we'll invite the other networks as well, so that the WHO will save some time also presenting, rather than presenting in all the regions, maybe they can present in 1 or 2 regions, and that can be a shared presentation. So thank you very much, Teonga, Chilunga. and everyone in the audience. Dr. Bunchay, you want to say a few words before we say good night?
No, thank you. You already said a lot of. I have to thank Tunga and Chalunga for this really fruitful discussion and presentation. We are looking forward to get the frameworks, and then we will, compare with our success and failure in Asia. Then we can mapping out several frameworks that would where is suitable for our regions. Thank you.
Thank you so
Thank you, Dr.
much.
Bunchay.
Thank you.
Thank you, everyone. Dr. Fadila, thank you. Professor Jong, thank you very much. Good night, everyone. Bye-bye.
Yeah.
Thank
Bye.
you.